Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the common nephrotoxic drugs. Many drugs are excreted through the kidney system. So is there anything wrong in the kidney or before the kidney? There may be a chance of nephrotoxicity. We'll go through the common drugs that cause nephrotoxicity, like number one, amphotericin B. This is an antifungal drug for subcutaneous and systemic mycosis. It is also used in the treatment of protozoal infection like leishmaniasis. Aminoglycosides are a group of antibiotics like gentamicin, amikacin, neomycin, netilmicin, streptomycin, and tobramycin. These are antibiotics, and they are also protein synthesis inhibitors. They have many uses. They may be used in case of UTI or any type of abdominal surgery. And this is the old drug, streptomycin, for the old-time treatment for tuberculosis. It is also used nowadays as an antibiotic, but it was previously used as a drug to manage tuberculosis. Cyclosporin, if you go there, cyclosporin, an immunosuppressive drug, selective inhibitor of cytokine production and function. It is used to prevent rejection of kidney, liver, and cardiac allogenic transplants. So this is an immunosuppressive drug. We have another immunosuppressive drug, that is the tacrolimus, an immunosuppressive drug, selective inhibitor of cytokine production and function. It is used for the prevention of rejection of liver and kidney transplant and is given with glucocorticoid. So these are immunosuppressant. So they help to keep the transplanted tissue in the body without going through destruction. So we got this. Now we'll go to the pentamidine. This is an anti-protozoal drug, chemotherapy for trypanosomiasis. There is trypanosomiasis brucei gumbians. Cephaloridin, an antibiotic. This is first generation cephalosporin that inhibits the bacterial cell wall, but it may cause proximal tubular necrosis. Cephaloridin. Cisplatin is an anti-cancer drug that is also nephrotoxic. Cyclophosphamide and ifosfamide. These are anti-cancer drug. Alkylating agent release acrolein in the urine, causing hemorrhagic cystitis. This inflammation of the urinary bladder, which can lead to fibrosis of the bladder. Lithium, there is a drug used to treat mania and bipolar disorder. Bipolar disorder, that means person has certain period of time major depression followed by mania, again depression, again mania. So this type of diseases managed by lithium is given orally and the ion is excreted by the kidney. Lithium salts are very toxic. Okay, then very popular analgesic, acetaminophen, also called Tylenol, also called paracetamol, is an analgesic that inhibits prostaglandin synthesis in the CNS. A prolonged and large dose therapy may cause renal tubular necrosis. So it is an antidote called N-acetylcysteine. Is the antidote for acetaminophen toxicity. This is the antidote for acetaminophen. NSAID, we have many NSAIDs like ibuprofen, phenacetin, naproxen. Even aspirin is also included as one of the NSAIDs. Phenacetin use is almost obsolete now. These are antipyretic, analgesic, anti-inflammatory drugs, but they may be associated with interstitial nephritis. Okay, except in aspirin, other NSAID are associated with interstitial nephritis. Acyclovir is an antiviral agent used for prophylactic treatment for herpes virus infection, transient renal dysfunction. Transient renal dysfunction may happen in a dehydrated patient. So patient should be rehydrated. Patient should take sufficient amount of water. So it may happen in dehydrated patient receiving the drug intravenously or taking orally at high doses. Foscarnet, an antiviral drug approved for cytomegalovirus, herpes simplex virus, herpes zoster virus infection, but it is associated with nephrotoxicity. Sulfonamide, methicillin, ampicillin, rifampin, thiazide, allopurinol, and cimetidine may cause interstitial nephritis. Sulfonamide is an antibiotic. Methicillin and ampicillin are also antibiotic. Rifampin is an antibiotic used in case of tuberculosis. Thiazide is a diuretic. Allopurinol is used in the management of gout. And cimetidine is an ACE2 receptor blocker, an anti-peptic ulcer drug. They all may cause interstitial nephritis, may lead to nephrotoxicity. Sulfonamide is no more used in the United States. Okay, we have the combination cotrimoxazole, sulfamethoxazole plus trimethoprim that is used in lieu of sulfonamide. Now the updated version, we have the cotrimoxazole, trimethoprim, sulfamethoxazole. So direct sulfonamide use is obsolete in the United States. Okay, so these all drugs may be associated with interstitial nephritis. Okay, so we now look at the site of action. Site of action of common nephrotoxic drug, amphotericin B. Its nephrotoxicity may happen in the perfusion of the kidney, proximal tubule, loop of Henle, and distal tubule of the nephron. Okay. Perfusion of the kidney is also hampered by cyclosporin and tacrolimus. Aminoglycoside, cephalosporin, cisplatin damages the proximal tubule of the nephron. Lithium, its mode of action is the collecting duct and it may damage that part. Okay, it may lead to diabetes insipidus, the lithium use. NSAID like ibuprofen, like naproxen, this medication may cause renal papilla damage. Cyclophosphamide, ifosfamide, these are the medication that may damage the bladder. That may lead to hemorrhagic cystitis followed by fibrosis of the urinary bladder. Okay, so we have some notes here. Assessment of nephrotoxicity is how we'll assess the nephrotoxicity by looking at the serum creatinine level and blood urea nitrogen level. These are associated with oliguria, decreased amount of urine, anuria, no urine production. So these are features of nephrotoxicity. Adequate hydration, electrolyte balance, alkalization of the urine can prevent nephrotoxicity and crystalluria in many cases. Antidotes are useful for some drugs, like in case of acetaminophen or Tylenol or paracetamol, we have the antidote, N-acetylcysteine. Patients with impaired renal kidney function should not be treated with any nephrotoxic drug. It will cause further damage to the kidney. Patient with the impaired kidney function should not be treated with the tetracycline. In impaired kidney, tetracycline is an antibiotic, and that is not to be used because it may damage the kidney, especially if the kidney is already impaired. Only safe is doxycycline among the tetracyclines. Two nephrotoxic drugs interaction may increase the renal damage possibility. And that's all about the common nephrotoxic drug. If you have any question, please feel free to ask me. Please share the information with your friends. And please support my channel. Please subscribe me. Have a nice and wonderful day. Bye now.